But first, it's night one of new COVID restrictions in Kansas City. Good evening, everybody. I'm Chris Ketz. It is 10 o'clock, which means in-person dining and bars have to close in Kansas City, Missouri. KMBC 9's Brian Johnson is live downtown at how the staff of the Quaff at 1010 Broadway is handling the change. Brian?
Yeah, it significantly reduced their hours, 35 fewer each week. They are able to do curbside, takeout, and delivery, which they hope makes up some of the difference. 7 days a week, many bars and restaurants have 5 fewer dine-in hours each day.
When I come in on Saturday, I start at 6, and I'm going to be here for 4 hours. That's it.
Matt Scott works at the Quaff Bar and Grill. Normally, dine-in closes at 3 a.m. It now shuts down at 10 p.m.
That's our busiest time. People start coming at 10 o'clock. I mean, we wait for people to get off work, and they all come here, you know?
The new rules are in place for nearly 2 months, at least until January 16th, 2021. It's a huge financial loss.
Cases are rising, and things need to be done, I understand, but it does kind of impact everybody's lives in the restaurant and bar business.
Restaurant workers hope the federal government provides financial help during the hardest point in the pandemic.
I mean, I would love the help. I mean, I needed it during the 2 months that were gone, where we were closed down and then shut down.
Other restrictions still in place for restaurants: 6 feet of separation between tables, a 10-person maximum at any table, and a log of all customers who sit for 10 minutes or more.
You gotta think about other people. That's what I think.
Restaurants are doing their part to slow the spread. In Kansas City, Brian Johnson, KMBC 9 News.
Now, the city says if you see somebody violating the new rules, you should report them to the city's health department, which you can do in an email to covidviolations@kcmo.org. Jackson, Wyandotte, and Johnson, along with Douglas counties, are also under new rules tonight. Starting Monday, the parts of Clay and Platte counties outside of Kansas City, Missouri, will begin new restrictions. They are similar to what's happening in the city. And for a full look at what they are and where, go to KMBC.com. Kansas is expanding its statewide COVID testing plan. The Sunflower State is spending more than $87 million federal dollars to double the scope of its virus testing. Kansas is behind Missouri and other states when it comes to testing. Kansas State Senator Jim Denning, Republican of Overland Park, says it should have started earlier.
We needed the testing rolled out probably in August to give us a bridge to the vaccine. Now we're in the thick of it, right?
I wish we could have done it earlier. You know, the fact of the matter is, 6 months ago, we didn't have the resources.
Governor says now they do. Kansas and Missouri have plans in place to distribute the vaccine when it's available. Tonight, a look inside one of Kansas City's biggest hospitals dealing with a surge in COVID cases and the possibility the worst is yet to come. This is what St. Luke's on the Plaza looked like in April. Staff was busy then, having added 163 beds just in case. But tonight,
we are very, very busy. Our teams are stressed. Our teams are fatigued. Our teams are working hard.
That's Dr. Andrew Schlachter, a St. Luke's critical care and pulmonology specialist. An internal staff email obtained by KMBC 9 News puts it this way: our ER is stressed with holds and closings. Our ICUs are at capacity and no end in sight. Our outpatient clinics are busy trying to keep patients out of the hospital. And it's why for now St. Luke's will only accept patients into its emergency department if an appropriately staffed bed is available. The hospital's common goal remains taking care of everyone, not just COVID patients. But to do that, St. Luke's will look at balancing surgical needs with bed capacity. And if a hospital in Arkansas, Colorado, Oklahoma, or Texas wants to send a patient here, the answer is likely no. Bottom line, they still have available beds at St. Luke's, but it's getting tight. And it's why things like wearing a mask are more important than ever.
The story here should be about a community that still, in part, does not believe this is real. A community that doesn't think that washing your hands or wearing a mask is important. And what I interpret from that is a message of one human being who is not caring about their neighbor.
It's becoming a common story at hospitals all over Kansas City. As a pulmonologist, Dr. Schlachter sees light at the end of the tunnel with the vaccine, maybe weeks away. But it's what could happen between now and then that has him worried. As of a couple of days ago, the St. Luke's Health System was caring for 181 COVID patients, the most since the pandemic began. New daily COVID hospitalizations are up in the 9-county Kansas City area tonight, and that includes people in hospital ICUs. Kansas City, Missouri is reporting 320 new cases and 3 deaths since yesterday. Kansas City, Missouri and Johnson County, Kansas have both reached the 20,000 mark in total cases since the pandemic began.